Ashwin Tamhankar. I am a consultant in Uro-Oncology and Robotic Surgery Services as a part of Surgical Oncology Division at Apollo Hospitals, Navi, Mumbai. So we are going to talk about, in general, about cancer awareness today because we recently celebrated World Cancer Day on 4th February this month, and the initiative taken by UICC organization for this was Close the Care Gap. And hence we are here to discuss about the same in details. Though I am a uro-oncologist, I am going to focus in general about or talk about cancers in general, and I will be discussing a bit of uro-oncology in addition to that whenever we discuss about the details. So if you can understand, a journey of a cancer patient starts from the diagnosis, then the cancer goes into an advanced stage, and eventually it spreads out of the outside the organ. We call it metastasis, or simple terms we call it stage 4 cancer, and then the patient succumbs unfortunately to that cancer. So the point which I am trying to drive here is we have enough window of opportunity at every interval for intervention to kind of halt the disease progression or possibly cure the patient if we can manage to detect the cancer very early. So all these aspects would culminate into the Close the Care Gap initiative, which is an initiative by UICC for this year. So there are few pillars of this as and when the patient progresses through the journey of the cancer. The first and foremost step which we should be aiming towards is prevention of the cancer. So preventive oncology has an immense role. Probably we should say that that's an important. Why do we need to treat the cancer if we can actually prevent the cancer in majority of the circumstances? Though the incidence of cancer is increasing enormously across the globe, and that is going to happen because of the lifestyle changes, the pollution, and certain other risk factors, but hence till then preventive oncology is an important pillar of keeping a check on the rise of the numbers of the cancers by all means. So let's talk about preventive oncology first. Preventive oncology would basically, it's a science in itself, honestly speaking. So it would have impact on the normal lifestyle changes of general population, not the patient, because here we are talking about general population. We are not talking about those which are diagnosed with cancer. It's applicable at mass population, it's applicable globally. So important pillars of it are healthy dietary habits, minimization of risk factors, regular day-to-day exercises to keep yourselves fit, and most importantly, minimization of addictions, which are the most important causative factors for majority of the cancers. Just to go in a little bit of detail about the addiction aspect, majority cancers in India are related to smoking and tobacco chewing in any form, and few cancers are related to excess consumption of the alcohol. So if we can control on these three factors, we can cut down on the tobacco chewing, we can cut down on the smoking, or maybe possibly quit the smoking or tobacco consumption and cut down on the alcohol consumption, that would definitely prevent majority of the cancers. And that effect doesn't happen overnight. It takes years of work as a community together, probably another 10 to 15 years of horizon. If you want to see the results at 15 years, we have to take action now because it acts on a long-term basis. And the most important pillar here is to educate the youngsters or adolescents, probably the children in school age group, so that they will have some important awareness about this, and they will have some principles inculcated into them since the early days of childhood, so that they can refrain from the addictions, so as to have minimization of the cancer incidence probably 10 to 15 years from now. It won't happen in next year. So that's about prevention. That's an important pillar. That is even before the patient is diagnosed with cancer. Let's come to the early detection parts. That's why there is an important terminology called screening. We have discussed about prostate cancer screening multiple times in the previous discussions. People must be following those discussions. Here I'm going to talk in general about cancer screening. So simply stating, screening is it has to be a simple test, obviously, because you're going to apply it on a mass population. So it is a simple test which will pick up early cancers with good positivity rates or good sensitivity, we call it in technical terms or medical terms, and it should be a cost-effective maneuver. We can't ask an extreme high investigation as a part of screening. It has to be a simple test applicable on mass population, that is healthy population, not only those which are diagnosed with cancer, but a healthy population wherein we can use some small simple tests to pick the cancers early in the initial days, which may not have been picked up at that particular time because of the cancer symptoms per se. Because any cancer will have an indolent phase initially, that is a phase wherein the growth of the cancer cells is happening. It's a phase which happens before the clinical detection. For any cancer to have manifestations in terms of clinical detection, it has to overpass that initial growth phase or growth curve. There is a nice curve which is always happening for all cancer cells, and it's an exponential rise in the beginning and then it plateaus or it flattens down, and that's the time when it actually gets manifested with clinical diagnosis. What does screening do? Screening helps us to detect individual in the exponential curve phase, so that we are trying to detect cancers even before they are manifesting clinical symptoms per se out of the cancer. So that is what the screening means. There are few cancers which are screen detected. Obviously, breast cancer, cervical cancer, so breast examinations, mammography, depending upon the eligibility and the guidance. The cervical cancers for pap smear, similarly for prostate cancer in men, they are the important pillars or important cancers which are diagnosed with screening. Similarly, testicular self-examination, which is generally important aspect, similar to what we encourage females for breast examination, we should encourage adolescent men to have testicular self-examination to kind of identify any nodularity or abnormality in the testicles. So these are all pillars of screening. Majority of the cancers are obviously not going to be detected only with the screening, but whichever cancers which are possible or which are easily amenable for early detection because of the screening, we should not be ignoring those cancers and we should not be ignoring those screening opportunities. That is what I would want to encourage people for. Another aspect here is normal standard health checkups. So we are probably in we are now in 2022. We have different kinds of investigations available under one roof in majority of the sectors, and that is what the health checkups are doing. So a standard health checkup, say about starting from the age of 40, 45, is to screen majority of the organs, screen majority of the blood investigations, maybe a sonography to evaluate that majority organs are normal without any problems. So that's what the health checkup does. So it's a need of an hour to have health checkups done for yourself. Majority of the corporate sectors will obviously have affiliations to the hospital, but standalone people who may not have corporate affiliations, they should come forward to get health checkups done to have minimization or to have early detections of the cancers. So the next step after screening, we are trying to run through the journey of the cancer patient, which we spoke about previously. So initial is screening, initial is prevention, then we spoke about screening, now we are going to talk about early detection. Why it is so important? Because if we can understand, early detection will have impact on the treatment of the patient. Majority, or it's an Achilles heel in Indian standards for majority of the cancer patients, that we are detecting these patients very late in the diagnostic line as compared to the Western countries. Just to give an example of uro-oncology, even more than 50% individuals whom we diagnose with prostate cancer these days are detected in a late stage of metastasis. Or talking about kidney cancer, nearly 60% of the individuals are detected in a stage wherein the kidney cancer is the size of the cancer is gone beyond 4 to 7 centimeters, and where we have a less opportunity to offer a cure or some early modalities of treatment for these individuals. So, and this stands true for every cancer, not just only prostate and kidney cancer. It's a standard uniform observation in India for all specialties of oncology, be it gynecological cancers or gastrointestinal cancers or head and neck cancers, thoracic cancers, breast cancers. We have more patients in a locally advanced state or a metastatic state or stage 4 cancers in proportion as compared to the West, and that has to change. And that change will only come if we have a great awareness amongst ourselves, because people in India tend to ignore their symptoms. Just to again give an example of blood in urine, in fact we had a session on blood in urine previously. So majority of the patients will ignore their first symptom of blood in urine on majority circumstances in India, which is a very harsh and bad reality, because that symptom may not manifest in next few months, and we are going to waste those months for early detection, and the cancer, maybe it's a kidney cancer or a bladder cancer, is going to go into an advanced stage, and that stands true for majority of the patients. A chronic weight loss, or maybe say blood in the stools, or dark colored stools, or change in the habits of bowel movements, or blood in the urine, or any deviation from the normal appearance of the body texture, any lump in the body where patient can perceive, should not be ignored. Similar quick example, it's a social stigma in Indian situation that people with penile cancers do not report it to the doctors in an early stage. They come with a large growth on the penis, unfortunately, and it doesn't happen overnight. It happens over months. Unfortunately, the social stigma has a very negative role in this particular stage, similar to what female gynecological cancers. Majority females may not report abnormal menstrual bleeds to the doctors at regular intervals. So this has to change. More important here is to create awareness than just talk about those high-end advanced treatments about the cancers. So early detection and screening are the important pillars of having a good cancer outcome. And again, like I said, if we start taking steps in that direction today, we will have results in next 10 years time or 10 years horizon, not immediately. So that's about early detection, reporting of your symptoms, not neglecting the symptoms at all, and reporting it to the doctor whenever there is a concern. So please do not hypothesize yourself. So just to give a quick example, it's a real-time example which I'm trying to tell here, not to make fun out of it, but to have more awareness that blood in urine can happen because you ate watermelon a day prior. It's an absolute bizarre impression, and it should not be taken so casually. So any blood in urine has to be reported. So likewise, all abnormal symptoms which you perceive, please report it to your doctor and let the doctor decide whether you need some investigations or not. So that's about early detection of the cancer. Then the next pillar comes as advanced treatment, or these days we call it precision oncology. So whenever the cancer is localized or locally advanced, meaning restricted to the cancer organ or just going around the organ without any distant spread, then we have an opportunity of that particular individual to be treated with an intention of cure or aiming towards cure of out of that particular cancer. With the high advanced modalities these days, for example, robotic surgeries for majority of the urological cancer services, or some high-end laser procedures, we have precision treatments available, or a laparoscopic or minimal invasive procedure. We have high-end treatment modalities available wherein we can offer cure to that particular individual. It's a multidisciplinary management, meaning you need services from radiation oncology side, medical oncology side, a good pathology backup, a good radiology backup, and obviously a dedicated surgical oncology team helps in building a good oncological service for a particular individual of a cancer, which we are committed to at Apollo Hospitals, Navi, Mumbai. So that's about the high-end precision cancer services. Let's talk about some molecular therapies and cancer services. So these are the treatments which are offered by the medical oncology team. The science is advancing. There are multiple trials which are happening on every particular cancers, for immunotherapy, for different types of chemotherapy. So the future is bright. We are thus, because of the advances in the science, we can still give good opportunity of the patient even in late stages of cancer to see few to many years with maintenance of adequate quality of life. And the last pillar of this particular journey is palliative care, a pain management team and a palliation team, which helps us to give decent quality of life to the patient in the late stage of the cancer. So we just discussed about the journey starting from the early days of prevention, screening, then early detection treatment, and then we covered about the aspects of advanced treatment and the palliative treatment. So most important highlight or a message which I would like to mention here today for all the listeners is be aware yourself, try and create awareness around yourself. So if someone is listening to us today, their probably duty is to talk to their colleagues, friends, relatives about the same aspects, so that the cancer awareness is spread Our motto is to spread the word on the cancer, because if we have to look into next 10 to 15 years of long-term goal for prevention of a cancer or minimization in the incidence of cancers, we have to take action now. So I wish you the best. Thank you so much.